feels
but I gotta
very
wait for
like an
her.
episode of Parks and Rec or something. So that's what would happen in that.
This is the second time. I mean,
Yeah, I heard it happened in the other.
yeah,
hopefully it didn't
right, when you
happen in
come for me, but this
ours.
is the third time.
We're gonna do
Yes,
one.
this is the third.
Different name every time.
Lisa,
So
would
he's
you
Yeah.
changing his name.
take him out?
No, it was, we saw
Remove
his
him,
name
probably.
before.
Well,
He's changing it, yeah.
Else claim the host, I wasn't
I
able
think
to.
Jason's, Jason's now the host, maybe?
Jason, are you hosting or is it still
Um,
Josephine?
I think it's Josephine. I saw a message on the conference room computer saying that Josephine claimed it as host.
Okay,
everybody.
Oops. Sorry, we are having some hacking problems, and so as we've been trying to get this completed, unfortunately, we may go in and out. We hope that we are able to conduct our meeting, okay? So Josephine, can we do roll call?
Okay. Okay, starting again, roll call. Pokey Balas, Beverly Gotelli,
Here,
Louis Johnson, William Kinaka,
Yeah.
Stephen Long. Is Stephen in the room? Oh, yes. Sarah Lancer Medeiros,
here,
Shirley Ogata,
here,
Susie Sober, Marilyn Seeley, Barbara Service.
I saw Barbara earlier,
Yeah, I thought I saw her.
but she's not on now. Maybe she's having problems logging in, Josephine.
Okay. Gary Simon,
Here.
Lisa Spencer,
Here.
Rick Tabor,
Here.
Charlene Taketa, Leslie Tanoy, Raylene Teno,
Here.
okay, we have 9 members quorum.
Thank you, Josephine.
You're
And
welcome.
again, everybody on Zoom, I'm gonna hope that we do not get hacked. But if we do, please be patient with us, okay? Caroline is not here today. She sends her apologies, but something came up that she's not there. The one that says Caroline is actually Josephine that's up there, okay? Going on, the minutes of August 1st were sent to you. We need a motion to accept the minutes.
Motion.
Motion by,
Second.
Steve, okay, moved by Rick, seconded by Steve. Any discussion on the minutes of August 2nd? Oh, sorry, August 1st,
Looks good.
okay? Here, no objections, no corrections. All those in favor of adopting the minutes of August 1st, say aye.
Aye.
Opposed, nay? Okay, we have adopted the minutes. The reports are there, the EOA report, director did put it in your packet that you had. Please, if you have any questions, write it down and email it to her, then she can get back to you, okay, when she can, okay? Beer reports, chairs report, I did call and I've been in touch with Public Access Room. Because as both committees know that next month, we will be having a joint meeting with the Public Access Room in the morning. The director and I have been also going over different issues that we've had here as to what we want to see on future agendas to come up for the board and future speakers. Okay. Legislative committee.
Okay, so we met this morning, somewhat interrupted, just like now. Senator Moriwaki and Rep. Corey Chun joined us for our meeting, kind of run down a little bit about Kapuna Caucus and bills that they're interested in. Over there, there's this sheet on both sides that Senator Moriwaki handed out, which is pretty good. What passed, what they're looking at maybe for next year. It's a preliminary kind of look. So take a look at that. In our meeting, we just ran down old bills and kind of who's gonna cover what. Next meeting will be in November. We're kind of gonna look at areas. Hopefully by then we know a little bit about what's gonna change, although it's gonna take a while. So we're planning to have a speaker each month. Folks are welcome to join that. That's separate of Fabia. to focus on our bills that we're gonna focus on going forward. I'll stop there.
Thank you, Rick.
Thanks.
Okay, Lisa?
Thank you. I did want to thank all the AAA groups for using our template. It looks like it's working well. We appreciate you using bullets to really highlight what it is that you're doing each month. And we are going to be using these templates to determine how we're going to go forward for 25-26. So thank you again for using those templates. If you have any questions or want to do any revisions to the actual template, please let us know. That's it. Thank you.
Thank you, Lisa. Recognitions and Awards Committee?
So I'm thinking we should start up again, meeting in November. So, and probably, and I'm just putting this out to y'all, probably stick with the same format that Kathy started, that I've been a part of for some time, meeting Thursday mornings. Probably from 9 o'clock till 9:30 on Zoom. The folks that are gonna do that, that'll be the next, November will be November 7th, I believe. November 6th would be the Thursday at 9:30. So we'll just start the process again. So recognition and awards for folks that are new. We're covering like the Older Americans Month. And then the AAAs, the counties do that in May. We do our thing in November. And we'll first in November, we'll meet, we'll talk about a date, and then we'll spin that out to you all on November 7th when we meet with you. Okay?
Okay, thank you very much, Rick. Okay, going on with our agenda, unfinished business. Review proposal on homelessness and determine Pavia's role in this proposal. Consideration for an ad hoc committee or PPRC to explore the initiative further. I'm gonna turn this over to Sarah, because Sarah did some research, and all of you should have had this sheet. That says Policy Advisory Board with Elder Affairs, Homeless, Unsheltered Action Proposals.
There's some more copies
There's some more
everywhere.
copies. Yeah.
Next to
If you didn't get
Tuesday.
one,
Yeah. So, basically, to sum it all up, that we try to help advocate legislatively for funding statewide to address, what's going on with the counties and in support of the counties and nonprofits who don't have adequate funding. And to do that, I'm suggesting that we support some kind of asset mapping, to use the engineering term, where we see, somebody sees that, and I don't know whose job that would be, but to what's available for homeless and people at risk. And on each island, and to evaluate them and see if there's, and maybe it would be the nonprofits and people who already service these people. Where are the gaps? For example, are they I can only give you information. So somewhere it says in the Office on Aging that this is a one-stop shop. Well, that's not true. It's not a one-stop shop. Maybe it's a one-stop shop for information only, not for hooking up with a social worker or a case manager or getting a ride or whatever it is. So that would seem to me, that would be really important to identify where those pukas are and then figure out how they can be filled. It might be that there needs to be an additional role somewhere in government to help facilitate that. And it seems to me that would be really important, and everything else sort of dovetails into this, where those gaps are, filling those gaps. Meals on Wheels only helps people who are not able, who are not able to get around. But if you are able to get around, you don't qualify. So that's the kind of gap right there, because you might need it. If you are an elderly person living by yourself and you're not on the bus line, and on and on and on and on, right? Then to support this idea of no wrong door, that's what it says in that mission statement for this office. And yet it is a wrong door if you actually need specific help and not just information. You need to hook up with somebody. So when we say no wrong door, we have to mean that. And I don't mean that in a in a disparaging way. I'm just saying what is currently, again, what is currently funded. And who, you know, and that sort of dovetails into this difference between Medicare and Medicaid. If you're on Medicaid, you can't get this service. If you're on Medicare, you can't get this service. You know, is there a way to bridge that? Maybe there's a business that can start bridging that, right? Okay, and then this other, the idea of cultivating a supportive, sensitive, div- environment in our communities. We were just talking about that at lunchtime. You know, people looking out for their neighbor. That's what we do here in Hawaii. We look out for our kupuna in your family. And whether it's to really remind people that older people need people to listen to, you know, they want their families to listen, they're important, they're not ready for the iceberg. And, you know, and maybe there's just more sensitivity, especially for people who are helping the people, the police force, the fire department, the people that come in contact with our elderly, the shopkeeper. I mean, I don't know about you, but I've been subject to a little bit of age discrimination when I not need help at the store, you know, where you're ignored and that kind of thing. So there's some sensitivity, I think that, you know, in the business community could benefit from that. So, and the rest is, you know, that. So all these things here sort of dovetail into that main idea here, and that is providing legislatively a way, a mechanism of some way, maybe to, whether it's a study, whether it's a call to action, I don't know. But here are some suggestions based upon other people that I've talked to in the community and people who are actually on the front lines helping our kupuna.
Thank you, Sarah. Any questions for Sarah? Gary?
Maybe just feedback. So how we are very familiar with our Hawaii Aging Network, right? It's the folks that we work with every
Yes.
day, right? It's a solid, robust network. Same thing on the housing homeless side. They have their PIC network too. So I think that's what I would say first is rather than driving strategies from our group to really cross and synergize both networks, right? So that means connecting with PIC, Partners in Care Network, connecting with governor's coordinator on housing and homeless. I think that's June Yang, I believe. And I think each county has our own housing homeless reps too, but I think that's where there's a lot of opportunities for all of us in general, is that we do have good systems in place, but oftentimes the systems don't synergize and
Right.
communicate with each other, whether it be, you know, the military VA side, Medicaid side, health systems, social care systems, and in this particular case, housing and homeless. So that would be my recommendation is cross and synergize across networks first, see what is being done, and then how we can fit into that.
Right, so that's the question is, how does that happen?
Yeah,
So auspicious does it
Okay,
come?
no. So Derek, as a follow-up, like she's saying, then would it be in Fabia's interest to make this suggestion to maybe Senator Moriwaki and Representative Chun, because they are the co-conveners of the Kupuna Caucus, that this is a statewide concern of ours. And if they could work with it, writing some kind of legislation towards this. I mean, I think when you're talking about that, and even if not legislation, but maybe a resolution to get that process of this, I don't want to say commingled, but this cooperative, the synergy, yeah, a
Yes.
synergy. So Sarah, I hope you're writing all this down, you know. Okay, because you know. Okay.
Being recorded.
Oh, that's right, okay,
Well-
forgot about that, it's being recorded, okay, but yeah, I think maybe that's our first steps, and maybe before even getting there. I think, and this is just my suggestion, it said for PPRC, but I think maybe it's something more for the legislative committee to look at. As to what is it that you would like to see, what is the end result you would like to see? And I think you need to also take into consideration that, you know, whatever you do as a resolution or legislation, it's not gonna happen overnight.
No.
Number one, it's the time.
It's the
Number
time.
two, it's the cost.
Right.
Okay?
But fortunately,
Hang on just a second, Jackie, okay? So, that's just the suggestions that we have now, okay, Rick?
Senator Moriwaki handed you her card and opened the door to have that discussion. So if you could, between now and the next time we meet as legislative, try to connect with her and see where you go with that, because she gives really good suggestions.
Thank you,
Yeah.
Rick, thank you, very good, okay? So, yes, Rainey,
So going on what you
There
were
it is.
saying with the different agencies. How much? Cause we fund some of these agencies, so how much of those agencies that would deal with these people does EOA fund? And,
Largely none.
none, okay.
Yeah, they have their own pockets of funds, so that's where a little, sometimes the challenge with the siloed networks.
Right.
Is by the source of funding that is being moved through. Yeah, so I
Yeah.
think like to what Bev said and the group said, the first thing is speaking to the right people to get the right people in the room together. And that's a
Yes.
good starting point.
Yes,
Mhm.
I would think
But-
so. I get that.
Rick?
One more suggestion though is build on strengths. What's working now?
Right,
And ask
Yeah.
those groups, where do you need our support or
Mhm.
help? So, I mean, really build on that they're already doing a lot of work with
Right.
horrible, large, ongoing issue. So what are the holes? What are the gaps? How
Right.
can we help with that?
right,
Good suggestion,
That's
Rick,
number
very good.
yes.
Okay, and, just to let you know that at our November meeting. November, right?
What, for what?
For the homeless speaker.
Yes.
Yeah, November, we are having somebody from the homeless to come and speak to us, okay? And excuse me, I forgot, in all our excitement that was going on with all these hackers over there, I forgot to introduce our executive director from Hawaii Island, Dr. Ui Fukuda. Okay, and we welcome you. So, maybe we'll give you a little bit, you wanna share about yourself a little bit to all of us?
Sure, yeah, so I am, from Hilo, Hawaii, born and raised. My education background is in, gerontology and psychology. So I have my doctorate in psychology and a master's in clinical psychopharmacology. Yeah, so.
Well, we welcome you aboard and we look forward to working with you this year
Thank
and many
you.
more years.
Yes.
Thank you so very much for being here. And I apologize, it was my fault. Okay, so.
You're a little distracted.
Yeah, a lot, yeah, I was. So anyway, going on. Okay. We're going to, keep the discuss the amendments because we haven't really gotten into that part yet. And I don't think the director got any feedback from, boards and commissions here. Okay, new business. Discussion on the abbreviated agenda for the December 5th, 2025 meeting. Okay, and everybody's gonna say, well, why am I looking at December? Because before we know it, the months are gonna be gone, okay? And the reason we are suggesting an abbreviated meeting is for those of you who are new to Pabia, we would like to have a Christmas celebration, and I'll be right forward with, we'd like to have a Christmas celebration. And knowing that our meeting starts at 12, we know Kapuna Caucus starts at 2. If we have a whole meeting, we're not gonna have enough time to do both meet. So that is the new business item that is before you. We can have discussion on it.
Why can't you just put it a little earlier? 11 o'clock,
Because you have committee meetings, Bill.
11.
You folks met till 11 this morning, correct?
Yes, we did.
10:53.
You're serving lunch at the meeting, at the,
Who'd have
Probably,
so then we
It
could
hasn't been
start at
determined.
11.
you know.
I'll start at
Um,
11:30 maybe.
Wait, so what is the?
Yeah.
Okay,
11
they're
o'clock would be
just
good.
discussing it right now, okay? And their suggestion, Bill's suggestion was, can we start earlier? And,
Take a break till 11:30. Half hour earlier.
I wouldn't suggest 11 because then you may have folks coming in a
Yeah.
little bit early, interrupting the legislative committee meeting. And then we would literally have to end, we may have to end a little early, so, and that's a time, it's December, 1 month before the legislature starts. So there may be a lot of discussion that we need, so we wanna have the full hour and a half. To have that meeting, so it's just a little bit of time between, so not right at 11.
Sorry, I'm confused.
Okay, go ahead,
What,
Shelley.
what is the dilemma or what is the proposal?
The proposal would be that the reports that we normally get from everyone,
Uh-huh.
that we ask the reports to be suspended until the next meeting.
Oh,
I mean, that,
yeah.
but you know what? I mean, no, really, the bottom line becomes, okay, the bottom line really becomes, okay, all the reports that we have, yeah, that we normally get in writing or orally, that we would ask that they be suspended until the next month.
So we're gonna defer them to January.
Correct. Okay,
Okay.
I motion.
no, okay, it's only up for a new business now, so for next month, okay, because it has to be on the agenda. So for next month, we will vote on that.
Okay.
But I wanted us to have the discussion today so that nobody can come back and say, well, you folks didn't talk about it, you know? But this is just a good thing for us to discuss now.
So would there be any, sunshine law or anything like that? If we defer something because we wanna have a Christmas?
No,
thing? Okay, I'm just.
no, as long as we put it down
Okay.
that we are doing this, and as long as our, ex officios are good with it, okay? And I don't see anybody over there saying, no, no, no,
Can
no.
we still
Okay.
offer that in writing?
I will, that's why this is only in discussion.
No, I-
Who has a hand up? Oh, Kathy says yes.
Thumbs up.
Kathy gives us a thumbs up. Thank you, Kathy. The other part would be that we would like to invite the ex officios if they are available to come and join us here, because once upon a time, okay, when we did have our meetings here, some of us can remember when all the ex officios were here too. And it was very, very nice to have them. So I guess on my part, it's a selfish part. It's a two-part thing. One, so that we can have the celebration, but also to invite our ex officios. to
Yeah, I
join us.
kind of tired of seeing you guys in boxes.
Okay, so anyway, next month I will put it out as a new business, as an unfinished business item, and we can vote on it at that time.
Okay.
I just wanted the discussion out for everybody at this point, okay? Thank you very much. Public testimony. Anyone?
Yeah, plenty.
Okay,
We
thank
had
you.
that today
Okay,
already.
Kabir reports? Rick, anybody? No? Okay,
Just-
sorry. Okay, appointed members, okay, Sarah, I jumped to you soon, so are you okay? Okay. Okay, ex officio members going down the line, and we thank those of you who sent your report in, or, the written report, we appreciate that. Okay, Kathy. Ishihara, Department of Human Services.
I don't have any current updates right now.
Okay, thank you. What's your referral? Okay, University of Hawaii, Christy Nishita, is Christy there?
She is
Dr.
not,
Norton's here, that's right.
yes,
Dr.
I'm, yes.
Hi.
Hello, yeah, I'm here and Christy's not here today, but yeah, I'm the new director for the Center on Aging. Nice to meet everyone.
Okay, thank you very much for coming and joining us. Okay, maybe you want to tell us a little bit about you, about yourself.
Sure, yeah, I can quickly. So I moved here almost 2 months ago next week. Originally Alaska native, moved here from Fairbanks, Alaska. I'm a gerontologist and social worker by training and have studied and worked within the field of Indigenous healthy aging and dementia caregiver work throughout my career as a more in the social work realm of workforce and training. So really excited to learn more and get more connected.
Well, thank you very much and welcome.
Thank you.
Going on, Paula, and Paula sent in our written report also, that's there. Paula?
Hi,
Thank you.
everyone. I really don't have any other updates other than what was in my report.
Okay, thank you very much, Paula. Okay,
You're welcome.
Department of Education, I don't see Tammy there. Okay, Department of Labor and Industrial Relations, Alan. No, Alan's not there today. Department of Education, Abby, nope. Oh, for Medicare and Medicaid Services. Welcome, Janelle.
Hi, everybody. Thanks for having me. Just a few tiny little updates from our regional office. So As you may or may not know, September is Emergency Preparedness Month, and CMS has curated some resources specific to our programs and initiatives, and I'm happy to share that via email. Some links and direction for everybody, beneficiaries, family members that you're welcome to use or pass along to your networks. Also, I'll make sure to put our regional office email in there in case you have any specific issues or concerns. We're happy to help navigate those casework for you. And then the last little update that I have is that we're coming up on open enrollment for Medicare. So that's October 15th through December 7th. I know there's probably going to be a lot of questions around that. And I'll be sharing more detailed messaging as it gets closer to next month open enrollment. So that's it. So thank you for having me.
Thank you very much, Nell. Thank you for coming on. Okay, agency reports. Okay, County of Honolulu.
We received exciting news yesterday that our reorganization plan was signed off by managing director. So we've been working on that for close to 2 years, negotiating with our Department of Human Resources, HGEA union, and finally had managing director sign off on it. So the highlight of that is that it significantly changes and upgrades our positions so that we as an organization can meet community need and the expectations of our funders as well. So going from, I would say, 3/4 of the positions on our old plan was more customer service positions, minimum qualifications of minimal customer service experience. We know in this room already that doesn't even hit close to the type of needs that our community had. So it brings up our positions largely to professional social work. This position creates outreach unit so that we can meet kupuna caregivers where they're at. So I'm really excited about that. We're gonna have to look at our numbers, but at least it gives us the opportunity to build into what we need to be now and in the future.
Okay, that's very good. Okay, the other part is that just as a follow-up, last month, because of the tsunami alert that we all had, one of the questions became to the AAA's Ruth, since you were gonna review what worked, where were the loops, the holes, shall we say, that, you know, the cracks between everything else, that maybe you wanna just share a little bit of what you folks learned in Honolulu County. That you folks may wanna do better the next time, I mean, not the next time around, it is gonna come. But what improvements do you see that you folks can make for a disaster plan?
I think that's a fair question, and it's what space do we have to be part of that larger
Right.
comprehensive supports, right, including with our emergency offices. What I would say is more on the resiliency side. So what role and space do we have to educate the community and kupuna so that they can advocate and plan for themselves? I think that's the strength of our network, to be quite honest.
Very good. And I mean, that question goes for all the execs because it was something that was asked last month, and because it just had happened, you know, prior to us meeting, it was a nice follow-up to know, because many of the AAA's were meeting with their other agency areas there. Okay, thank you, Stacy.
Oh, I don't,
That's
No.
on.
so Raylene mentioned that
I don't think, yeah.
similar to our reorg, we've been
Okay.
wanting that for
Right.
years, right? Feel like I keep jinxing myself,
Oh.
but on the newspaper, since it's out on the newspapers already, Civil Beat and Advert. That city is putting pen to paper on the acquisition of a property on School Street.
Oh.
Pen did not hit paper yet.
Oh.
Yeah, but it was enough traction where it went onto media already. It interviewed our director. So hopefully at the end of this month or early next, the pen will have hit.
School Street,
the
right?
paper. Right off the School Street off ramp, there's a 3-story admin building that's CPB. It was CPB, Central Pacific Bank's admin building
Off ramp.
there.
I just tried to think the School Street off ramp.
You go up.
Yeah.
Yeah, you go up and on the right hand, because it's a one-way street going
Yeah.
down.
Yeah, we have, if you folks remember, we have $2.5 million in federal earmarking that we acquired from Congress, and we're never be able to tap into that yet. There's a good amount of shelf life on those monies.
Oh, that's good.
Yeah, but until we acquired a building, which I've been telling you folks, how we get so close and then the rug gets put out
Yeah.
from us. I didn't wanna
Jinx yourself.
jinx
Sorry.
ourselves. No.
So this is for EAD to relocate to?
So, if you're familiar with, City and County of Honolulu, one of our departments, maybe similar to Maui, Department of Community Services. So we have maybe four or five different divisions in there.
Mhm.
3 divisions are likely gonna go into this new building, but a good portion of one of the floors are going to be dedicated to building a community accessible, universally designed aging and disability resource center. Cause right now, we're only that in concept, not in physical infrastructure, not in physical space.
So you can actually take walk-ins.
So, right.
Yes.
So that we can take
Yeah.
walk-ins, that we have a multi-purpose room like you folks where you can have community meetings.
There's
you can
parking?
that's the tricky part, that we have there's more parking there in here
Okay.
than what we have now.
Right.
We're starting initial discussions with transportation office to see on like bus routes and things like this. The streets are small in that area.
Yeah, very
Yeah,
smart.
they're
Very
small, but
It's
this,
suggested.
but we wanna see what we can do.
Yeah.
Good, well, thank you, very good, that's good news, thanks, Raylene, I didn't see that, I mean, I don't read still and stuff like that, but thank you. Okay, Hawaii County,
Going off of the tsunami preparedness, something that, happened for us when pulling reports of Kupuna in, their addresses, phone numbers, the things that were coming up was the reports were not matching up the names, the addresses, or it kept, printing pretty, just not able to, correlate with the name and address. So that was something we worked with Well Sky, post tsunami warning, to get that figured out. So the next time something happens, we can just pull a report quickly and get it to our partners like transportation, those who do home delivery, so they know where the addresses are of those people. So that was something that came up. And then another thing we were talking about was implementing into our contracts with vendors to do a post summary, for them when they, regardless if the natural disaster happened or not, what worked well for them, what didn't, so that we can include that in our, reports and have that for ourselves. So that's something we're working to include. So it's very good that it was just a warning, but it helped us to see what we could kind of beef up. Another thing that kind of happened, not tsunami, but we had a resident who, she came in because she was feeling sick one day and, you know, she kind of wasn't feeling herself. She ended up going to the hospital, found out she was diagnosed with sepsis. So, she had no idea what sepsis was. She came in to kind of tell us, you know, she wants there to be more information accessible to our kupuna and our community on what sepsis is. So we've been working, we created a pamphlet, put it in our silver bulletin to get out to our mailing list for our kupunas, but we're also working with like the hospital, trying to get, collaborate with them or our community health clinics to do more like, education, training around various like, health issues. The same thing with like emergency preparedness, doing more trainings to kind of get our, like Derek was saying, you know, prepared and able to advocate on their own. That's a very good substance. Yeah, it's happening. So that's why we're trying to do something to kind of get, more people familiar and just awareness of it.
thank you,
Yeah.
and welcome, thank you. Emily, Kauai District?
Okay, hi. I just have to apologize. I don't know what happened to my camera. It was on the 9:30 meeting, it was working, and then now it's not. So I'm very sorry about that. IT should be on their way. But anyway, I just wanted to kind of piggyback on what everyone was saying, that after the tsunami warning, it really had our team kind of up our game on what our plan was for emergency and disaster preparedness. And so we are able to take actually the advice of the Big Island with Erin, and, you know, she had suggested working with our contractors because historically we have, historically, we have contacted our consumers ourselves. But now we learned that in the disaster, we're gonna have our contractors be responsible to do that. So that's kind of shifted our perspective on what we need to do as an agency but yet still keeping track and fulfilling, our communication, keeping an open communication with our consumers and our elderly to make sure they're prepared, but also looking out for our staff as well as the community, increasing our steps and what to do with the EOC when we work with them, and that kind of chain of command and how that works. That we had something where we had to get information to them. So now we have a clear path of what to do for the next time, because like you said, there is going to be a next time. So thank you for having us add that in our report. I just wanted to also say on a separate note that just grateful. I took one of my staff to the Alzheimer's Coalition this last week, and that was very informative, insightful, and super appreciative for that opportunity. And I'm just looking forward to seeing whoever's going to go tomorrow to the HPGS conference.
Thank you, Emily.
Thank you.
Rowena. I know she's there, right there.
You're muted.
Yeah, you're muted.
Regarding the emergency preparedness topic, so yesterday at our Council on Aging, we had a presentation on CERT. I think the CERT means Community Emergency Response Training. And the Council on Aging members were interested in specific training for seniors. So we'll be working with Maui Emergency Management Agency to hold those trainings, because we're finding that a lot of the issues or the topics that are addressed in the training do talk about your own personal preparedness and how to handle medical emergencies and things to look out for. So it's a really good training for seniors, not just for younger adults, but I think teenagers up until seniors over the age of 60. I think I recall a senior being in his 90s getting trained in the CERT program. So we're encouraging more of our older adults to take advantage of that program. Another thing that we're doing is continued education with our senior clubs. So we've had presentations. MEMA and Office on Aging have been kind of tag teaming and holding presentations with different senior clubs throughout the island, the senior clubs over at Halemaho'olu, and also encouraging the seniors to create a go bag and prepare your own preparedness plan. Also last week, AARP held a presentation for the senior resident facilities, which include Halemaho'olu, on how to create preparedness plans for their facilities. So they went through, we had MEMA as part of the presentation. They gave a introduction on the different hazards and risks to look out for. And then AARP with their consultant presented the preparedness plan that can be implemented at the facilities. So we're targeting different agencies and different groups throughout the year, and not just focusing all of our education during hurricane season, but I think the ongoing continued education throughout the year will be beneficial for our community. Another partner in this is Maui Electric. So I understand they've been also holding presentations with different organizations regarding the public safety power shutoff. With respect to the tsunami warning, some of the feedback that we got from seniors, especially those out in Hana, was that, to ask, can the alerts be done in a different way? Because the warnings, the sirens made some of our seniors and members of our community with disabilities very anxious, and they're kind of sensitive to that. So, we're kind of discussing different possibilities for ways to get the communication out, maybe through a phone or some other device. Another issue was being able to get good information. Some of the seniors had indicated that they really didn't know where to go. And I think part of it was getting the information later. I think the tsunami was supposed to hit around 6:30, and information about the evacuation places, the shelters, was done at 5. So that was an issue. So there's certain gaps about getting good information that need to be addressed. And then also encouraging people to sign up for the phone alerts through Maui Emergency Management Agency and through the Genesis program that was implemented a few months ago by Emergency Management. So those are things that we need to work on as a community. Part of my update on our 4-year plan, I wanted to highlight that our Commission on Persons with Disabilities received a presentation from the Planning Department about the Lahaina rebuild. And so they put together a letter addressed to the mayor and council chairperson Alice Lee with some talking points to consider, including commitment to accessibility and inclusion, creating more accessible and age-friendly housing, and building a more inclusive and livable community, which means that people can age in place in Lahaina, and in other communities as well. And then making sure that the information about rebuilding is accessible to all people in the community, and that they stay engaged with the commission members. So those are basically the highlights. I mean, I also wanted to share that the partnership that we have with the prosecuting attorney's office on providing different senior clubs with financial and contractor scam information, that's been taking off pretty well. A lot of our senior clubs are very interested in the topic. And most recently, I shared an experience, and I think Christina, you were on the call yesterday, where there's targeted text messages that are going out to people, where I got one the other day, and I know this was a scam because I didn't recognize the phone number, but they were asking me, hey, would you like to get together sometime so that you can share with me your pinakbet and adobo recipe? And I didn't know who it was, but I knew enough not to respond to that, because once you start to engage in a discussion, the person on the other end is not going to stop. And while we were on the meeting yesterday with the prosecuting attorney's office, APS, police department, I got another text message saying, hey, can we meet after work today and get hot pot in Chinatown? And I'm thinking, wait a minute, I am not near a Chinatown, but for some reason, ethnically, these scammers are getting very smart and picking up, I don't know where they're getting the information, but it's something to look out for. So I just want to share that with everyone, and to also get the information out about financial scams and fraud, because it's starting to really pick up in our communities. And
Thank you. Okay, any questions for any of the directors? Okay, just to share with what Rowena said, and I shared it with Derek just now, when she said she got that about the peanut bit and everything else. I told Derek, I received one to say, hi, how are you doing? We're gonna come to visit in Hawaii soon. Let's get together. Are you still there? So, if you're asking me, do I still live here? You really don't know who I am. So you delete it, you block it. That's all you do. I mean, that's all you can do. So like Rowena's saying, hey, it's out there. You just gotta take care of yourself. I mean, really, you have to be your own advocate on things like this, on these scams. Okay? Next meeting will be on October 3rd for Pavia. The committee meetings will also be held that morning at 9:30. And we will be having a presentation by the public access room that morning. Kapuna Caucus met last week, Friday. But their next meeting will be on October 3rd at 2 p.m. via Zoom. Okay, with that, I thank you all very much for obliging us by agreeing to change the meeting date way back in May. And also, I will have on the agenda for the next time to vote on the change of a December 3rd to an abbreviated meeting. Okay, with that, we are adjourned at 12:49 p.m. Thank you. Josephine, Susie came online, so Susie's here. Okay.
For 2026.
Okay, thank you all very much.
Thank you.
Thank you,
Thank
thanks.
you.
Bye.
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 Okay, hang on. Tony, you wanna close this first?
Audio.
Oh.